So good morning again, everyone. Welcome to our Saturday Shorts Club, which is actually a very special Shorts Club event. So before anything else, I'd like to introduce myself. I am Aubrey Morla, a graduate of the OMMC surgery, general surgery residency, and previous chief resident. So for today, as I said, we have a very special Shorts Club activity, which is which is meant to inspire our residents, our PGIs, our interns, and our clerks. So this reminds us that even the great ones had to start somewhere. So before anything else, I'd like to acknowledge the presence of our chairman, Dr. Jeffy Guerra, our consultants, Dr. Pensurga, Dr. Villanueva, Dr. Celso, Dr. Miranda, Dr. Chorino Alves, Dr. Velez, and one of our speakers for today, the esteemed Dr. ROJoson. So the title of our event for today is Surgery Training Across Generation, an inspirational talk from the mentors. So before anything else, I'd like to remind everyone to please mute their microphones as we go on the program. And I hope that you may get inspired as we have intended to by our esteemed guests and mentors. So as you all know, all the great ones had to initially endure hardships at the beginning, and I hope personally that this inspires all our residents and our clerks and interns. So for our invocation, may I call on Dr. Gerard Gaspilio.
Good morning. Let us put ourselves in the holy presence of the Lord. In the name of the Father, the Son, and the Holy Spirit. Amen. Lord our God, with all our hearts, we come before your countenance. Our hearts shall always be in your presence, asking, longing, and believing that you will guide our affairs. Protect us, for you are our God and our Father. Protect all who are in danger and who must go into danger. Make known your great love and your living presence to the hearts of the dying. Draw our hearts together so that we may have community in you, our faith and hope set on you alone. Protect us during the night and help us to be at peace about all our concerns, because they are in your hands. Every concern of every person is in your hands. We ourselves are in your hands, Lord God, our Father, and there we want to remain. Your hands can heal and restore everything. Amen. In the name of the Father, the Son, and the Holy Spirit. Amen.
Thank you, Dr. Gaspilio. Before we start, if there are other attendees, they may also access this this Zoom conference via Facebook Live and YouTube. So without further ado, let me introduce our first speaker for today. I'm sorry. So, before anything else, may I welcome Dr. Jeffy Guerra to welcome everybody to our event.
Yeah, thank you, Aubrey. Before we proceed with our main activity for today, let me welcome all of you. Okay. Good morning, everyone. In behalf of the consultant and resident staff of the department, I would like to welcome you all on our weekly Saturday Swartz Club activity, this time entitled Surgery Training Across Generations, Inspirational Talk from the Mentors. It is my honor and privilege to welcome back our mentors to share their time and thoughts on how to survive the general surgery training. Tips and tricks, if you may. They have been through all the life stages of being a surgeon, from the time they were a trainee to becoming a trainer and administrator as well. Their invaluable insights, I am pretty sure, will help a would-be surgeon to be inspired amidst the rigors and training, especially at this particular time. Our esteemed speakers for today, in one way or another, made a mark during our time when we were residents, and even during medical school. OM surgery and PLM graduates can attest to this. Dr. Pinserga and Dr. Mirasol Lumage were my teachers in Surgery 1 and 2 at the Pamantasan, while Dr. Joson was my chairman during my residency days, that was around 2003 to 2008. And Dr. Penserga was my research advisor back then, as well as my chair when I was the TO. Wise and I shared some time during and after our residency. Their insights and lessons from the past can be bridged today so that our dear residents can appreciate how privileged they are to be trained in surgery. This will also serve as a reminder to us, being the active trainers now, to carry on the task handed to us by our mentors in order to continually strive to improve the training climate of general surgery. Also, I would like to thank Cecil and Glenn for coming up with this activity as an icebreaker from our routine Saturday Swartz Club. No doubt, after the end of this activity, our residents will be more inspired, equipped, and resilient in facing the challenges ahead. Again, welcome and enjoy the morning's conference.
Thank you, Dr. Guerra. Message. So for our next speaker, perhaps he may need no introduction, but I will do my best to introduce him. So our next speaker is Dr. Reynaldo Joson. He graduated from the University of the Philippines College of Medicine and obtained his general surgery residency training at the Philippine General Hospital. He obtained his master's in hospital administration from UP Manila College of Public Health, master's in health profession education at the UP National Teacher Training Center for Health Profession, and Master of Science in Clinical Medicine, General Surgery at the UP Manila College of Medicine. So he is a diplomate of the Philippine Board of Surgery and a fellow of the Philippine College of Surgeons. He is a consultant in various institutions at the PGH, Ospital ng Maynila Medical Center, Medical Center Manila, and Manila Doctors Hospital. So among his many achievements, he is an examiner from 1984 to 1997 of the Philippine Board of Surgery, a Mamadi Sudavar Memorial Fellowship, traveling fellowship for study in cancer centers from July to December in 1984. He is a faculty of the UP College of Medicine and a training officer of the Department of Surgery at Manila Doctors Hospital from 1985 to 1987, where he was also the Assistant Medical Director from 1989 to 2009. So he was the chief of the Division of Head and Neck, Breast, Esophagus, and Soft Tissue Surgery at the Department of Surgery at PGH from 1994 to 2000, and our very esteemed chairperson of the Department of Surgery at Ospital ng Maynila Medical Center from 2001 to 2009, where he still remains to be our chairman emeritus up to this day. So back in 1986, he was the Department of Surgery Hall of Fame. He obtained the Department of Surgery Hall of Fame for surgical consultants and was instrumental in the creation of the first head and neck surgical oncology fellowship, the first surgical Oncology Fellowship in the country in 1990, and he was awarded the UP College of Medicine Alumni Society Outstanding Educator Award in 2003. So among his many, many awards, he was instrumental in the department getting the Asian Hospital Management Awards Knowledge Management System in 2004 and the Asia Corporate Social Responsibility Awards Conducive Practice Program in 2005. Amongst this, he was also awarded the Philippine Society of Oncology Most Outstanding Teacher in Oncology in 2006. So to add to the numerous awards, he was instrumental in giving the department. He was the chairman when the department won the Anvil Award for Holistic Corporate Social Responsibility Program in 2005. So he was the UP Manila Centennial Professorial Chair Award in 2008 and Exemplary Alumni Award of the Xavier Kwang Chi School in 2013 and also the Exemplar Award from the Manila Doctors Hospital in 2015. He also obtained the UP Alumni Society Lifetime Distinguished Achievement Award in 2015 and the UP College of Medicine Distinguished Alumnus Award in 2019. So he was also recognized for his pioneering efforts in Zamboanga Medical School Foundation, now known as Ateneo de Zamboanga University School of Medicine in 2019. And most recently, he was awarded the Philippine Medical Association Dr. Jose P. Rizal Memorial Award in the Academe category in 2020. So again, perhaps this doctor needs no introduction, but I am very honored to welcome him to our conference today, Dr. Reynaldo Joson.
My general surgery residency in the Philippine General Hospital, 1976 to 1981. This is a talk to inspire aspiring general surgeons as well as a memoir. This was prompted by a request by the 2022 Training Committee of the Department of Surgery of Ospital ng Maynila Medical Center on March 14, 2022 to give an inspirational message to the residents through a narration of my experiences in surgical residency, the trials, and how I managed to cope. This narration may well serve as my short memoir containing slivers of experiences during my general surgery residency in the Philippine General Hospital. First, why did I decide to go into general surgery for my specialty training? After passing the Philippine Board of Medicine in 1975 and serving the mandatory 6 months of rural medical service in Jumalik Island, Quezon Province, I decided to go into a general surgery residency training program starting 1976. My rationalization consisted of the following.
Thank you very much, Dr. Joson, for needless to say, a very inspiring message to our surgery residents, and to as well as the young consultants or and to the consultants who are currently engaged in private practice right now. I am reminded of what Dr. Guerra always says, that at one point in your career, you will realize that there's something more than money to make you happy. And I'm glad to say that the residents are still being trained via the Hosonic way, as we say. And to give the floor to one of your most ardent disciples, if I may say, may I welcome Dr. Jeffrey Guerra, our chairman, to give a testimonial for Dr. Hosan.
Okay, thank you, Aubrey. Aubrey texted me last night, and also Glenn, to give me the task to react for Dr. Hoson's speech, and content. And I know that when I received that call, it will be very daunting and hard for me to put words to what I feel, really. And as I always tell the residents, we were trained by Dr. Joson and Dr. Pinserga to hand to you down all the traits that's needed to be a good surgeon or to be a good doctor. So first of all, I also asked my contemporaries, I see Dr. De Guzman there, Dr. Siwais is also there. I also saw Joma. These are the group of people that has really directly influenced by Dr. Joson. So when we were residents back then, as I can sum it up, I have known Dr. Joson for almost 20 years now. And this is only the time that I came into a realization that ngayon ko lang na rin yung very specific from how you deal with the rigors of surgery up to how you establish your practice. This is a very detailed Hosonic way to put it, to inspire all of you. So, as a matter of fact, when we became active consultants at OMMC, and we attended different conferences like your Philippine Association of Training Officers in Surgery, that some of the programs now were actually being done by the Department of Surgery when we were resident. That's back to 2003 or 2004. We already had our distance learning program. At the height of a dial-up internet connection, we also have that. We also have the residence portfolio, being our requirement for promotion. So if you Google our names right now, you can see our outputs during 2004 to 2008. And from there, I was a part of Dr. Hoson's vision. Ito ang pinaka-important for a chairman or administrator, to have a complete tunnel vision of what you want to do 5-10 years from now. And I was also part of the team that was awarded the Asian Hospital Management Award, the Anvil Awards. These are the golden days of OMMC. And up until this point, I am really, really grateful that Dr. Joson has trained us the way we should be trained during that time. And always remember that the cornerstone of being a successful resident is what Dr. Joson have said a while ago. That is being disciplined and resilient. Okay? So you just have to do it. The system of training in the Philippines and probably on the Western world is the same. Nandiyan yung sistema, the patient load, The only difference are the people being trained. And in all honesty, we are sandwiched between yung dating hierarchy ng surgery up to this point that we are now transitioning to your conducive practice environment, safe working environment, your well-being. So we have to really determine a thin line, between these two, so as to have a good graduates at OMMC. Okay? With regards to your practice, I also agree with what Dr. Joson has said earlier, that there are stages in your practice. I dub it as my first decade, second decade, and third decade of your practice. The first decade of your practice will be more of investing on yourself, investing financially, investing on your colleague. And then the second part of your stage of your surgical life is to pump on legacy. So we have to be very holistic, not just as a successful practitioner, but more so as a community leader, a trainer, a researcher. Ito yung kailangan nating i-achieve. So all in all, we have to have a planned approach in everything that we do. We have to categorize everything and specify our goals and how to achieve them properly. Along the way, there will be bumps in the road, but with all your foundation, from your med school, from your early days of training, there's no doubt that you will be a successful surgeon in the future. So again, if I can ask Dr. De Guzman, Dr. Wise, and Joma to add on what I have said, I will be appreciating them.
Thank you very much, sir, Dr. Guerra. Dr. De Guzman, if you may give a few words, sir.
Yeah, nice to see Dr. Joson again, sir. Good morning, sir. Well, agree with Dr. Joson has said kanina, no? Nobody said it was easy by the scientists, no? But with Dr. Joson's, nung ako resident, no? With Dr. Joson's guidance, no? We surmount the hardship of being a resident in surgery. Another is for the residents, no? We take it year by year level yan, no? Hindi kayo mag-stay dyan, first year kayo for a long time. Isang taon lang yan, first year. Isang taon na second year. But with Dr. Joson's advice kanina, do it with flying colors. Always achieve excellence, no? Yun lang naman para malusutan nyo year per year level. Take it one day at a time, no? Ang pagiging resident sa GS, although 5 years tayo, hindi yan mahaba. So, in a blink of an eye, tapos na kayo in 5 years. And then, ang pagiging resident, hindi magtatapos doon kasi, no? Yun din, kailangan recognize kayo ng society. So, utang na loob nyo sa institution nyo na kayo ay maging diplomate, maging recognized surgeon one day. No, balik yan kasi hindi ang institution ng Ospital ng Maynila, just like any other training programs, kailangan nila na ang kanilang graduates ay maging recognized. No? Hindi tayo diploma mill. No, hindi tayo diploma mill. We want our residents to be recognized surgeons in the Philippines. Not only in the Philippines actually, in the whole world kung maaari lang. So, yun. Ang dami kong natutunan kay Dr. Joson. Hindi ko makakalimutan yung PMP. Still, ayan, explaining to the patient by using the patient management process. I was able to explain concise, precise to my patients and relatives kung ano ang diagnosis ko, management plan ko sa pasyente. And a very limited time, tama si sir. No, hindi mag-aantay ng matagal ang pasyente sa clinic. Well, yun lang. Thank you very much, sir, Dr. Joson, for all the guidance, sir. Thank you, sir.
Welcome.
Thank you very much, Dr. De Guzman. If I may also welcome Dr. Wise Pedialva. Good morning po, ma'am. If you may kindly give us a few words during your residency.
Hello.
Good morning, ma'am.
Good morning, doctors. Good morning, mga sir. Good morning, Dr. Joson, Dr. Benserga. Actually, in addition lang to what I said in my pre-recorded message, ang secret siguro is you have to be intentional in everything that you do. Hindi yung ginagawa mo lang ng bikahon. You should know why you are doing something. Yung reason behind yung want mo to become a surgeon for entering the training program. Hindi pwedeng yung dahil na-impluwensyahan ka lang, hindi pwedeng yun yung uso. You really have to want it. Kasi otherwise, lahat ng bagay magiging mahirap kahit yung pinaka-simple will be very hard for you to accomplish. Yun lang, yung in addition lang to the pero yung mga system, you have to imbibe yung mga tinuturo talaga ng consultant kasi marirealize mo lang siya when you go out. Marirealize mo na when you observe yung practice ng ibang doctors, makikita mo kung gaano kaiba yung tinuro sa atin dyan sa Ospital ng Maynila. It's really very different and you'll feel very proud talaga na ganito yung tinuro sa'yo and ganito yung pina-practice mo. And you will go a long way. Basta lang, alam mo yun, wag masyadong sensitive, kumbaga, no? Syempre, iba na yung way ng thinking ng bagong generation. Pero, yung puso ng pagiging surgeon, yung puso ng pagiging OMMC surgeon, dapat laging nandun. Yun lang. Thank you very much then, Sir Dr. Joson, and to all my seniors and other consultants. Salamat po. I want to take this opportunity to thank all of you for all that you've taught me. I really appreciate it, sir. Nagagamit ko po talaga lahat ngayong practice ko.
Yes, ma'am. Thank you very much po,
Thank
Dr.
you.
Pedrialva. And lastly, can we hear from Dr. Malabanan, sir? Good morning po.
Hi, good morning.
Morning, sir.
Good morning. Hello, good morning. First, I would like to thank all my seniors, my senior consultants, my bosses, Wise and I, and together with Mike Stunyas, we all practice here in Calamba, and we're proud to say that that we are living with the thinking of the teachings of our seniors, una muna pasyente, saka na yung pera, tapos always use the patient management process in treating your patient, Then the main topic I think here is about how to manage the residency training, So if you're going to in addition, all of you have their own stress relievers, for the residents who are already, because during that time I was already married, and second year I was already married and had my first son. So during that time my family was my inspiration. So in your residency training, find an inspiration, then always look back to your roots, always be thankful to them. I'm very thankful to my seniors, because of most of the techniques that we usually use came from them. And yun, talagang sobrang thankful ako sa mga bosses, sa consultants natin. As I remember it, pagka sa resident, no, magkaroon kayo ng bonding, no. During that time, nagbabike kami sa Rojas Boulevard. May mga time na nagja-jogging din. May mga time na malapit na yung summer, no. Dr. Hodson, if I can remember, nakapunta pa kami sa
Anilaw.
sa Anilaw, no. Si Sir nagano pa yan, talaga inaasikaso kami niyan sa I remember the buko. Yung buko, masarap na buko sa Batangas, no. So try to balance everything. Then again, yung holistic surgeon, no, laging pumapasok sa isipan ko yon. Yon yung kasi when you are on your own, marami kang pwedeng puntahan eh. You can be a businessman, you can be a teacher, you can be a researcher, you can be yung pwedeng maging head ka ng hospital, pwede kang maging marami pwedeng mangyari. Pero from as you practice, no, isipin mo lagi parang may kulang. So laging kailangan kasama diyan pagiging service oriented. So yun lang naman po. Then God bless and good luck to our residents. Service oriented, God fearing, importante po yun. So thank you.
Yes, sir. Thank you po, Dr. Malabanan. Before we wrap up today's event, if I may ask for a few words from one of our esteemed guests, Dr. Joson.
Okay. First of all, I'd like to thank everybody for this honor and privilege to be part of this program. I really appreciated this program and give importance to it. That's why I really prepared for it, and then I made sure that I attend it from start to finish. And this program really touched me in 2 or 3 ways. Number one, hearing the sharing of my former residents, specifically Wise, Celso, Jeffy, Janix, and Joma, who have who have shared their experiences here. Okay. I was forced to think back, reminisce the days when I was training them. Okay. Of course, I'm proud of their achievements, of their years in the Department of Surgery. I know how they perform. But the main question I was when I was listening to their sharing is that did I really train them well? Okay. Although this is a talk to inspire the surgical residents, but as a mentor, hearing the sharing from the former residents, I now ask myself, did I really train them well? No? Okay. So this is a self-evaluation on my part. No? Okay. So I think modesty aside, I would like to say that I am happy, okay, with what I heard, okay, and I think they have turned out to be well-trained surgeons. That's good enough for me. Okay, so after hearing their testimonial. Number two, the way how I was touched by this program is that just like Dr. Penserga says, Egay, no, this project is really laudable. Okay, it's innovative. Okay, so as Egay mentioned, you rarely see such a program. Okay, so I'd like to congratulate the training committee and of course the chairman being the guide in this particular program. Okay, so I would suggest that probably you continue on with this project. Okay, since at this time, this is the first launching or so-called launching Okay, and it's documented. Okay, it's probably because of your live recording. It's also in the internet. Okay, so practically, or I would assume that all the residents, okay, at least all the residents in the Department of Surgery of OMMC have seen this, okay, have heard about it, no? And then this will force them to reflect on it. And then probably next year, you just present it to the incoming first year, just to have a continuity of this laudable project, okay? And then to make a second series, probably after 5 years, you invite another series of 3 or 2 to give the same talk, same title, same objective. Okay, so as I said, this is a laudable project. Okay, and I am proud of it that the present administrative staff of the Department of Surgery is doing their very best, and then okay. Actually, honestly, I've seen a lot of these programs being innovative programs being projected in the internet already. Okay, unlike the other departments. Now, okay, so this is a program of the Department of Surgery, the resident staff, not the department consultants. Okay, okay. So now the third one is I'd like to say that I have to confess that I really learned. As I said, I stayed on because I want to learn something, and also, okay, see if to do some self-evaluation, what happened, and also to learn from the other. I just learned about the speakers, the 2 other speakers last night. It's Wise and Lumagi. Okay, okay. So I'm happy to hear their inspirational talk also. I learn from them, not only as a surgeon in my twilight years, but also as a former mentor. Okay. Okay. Although I said former mentor, but I have to confess that I'm still actively teaching. Okay. Although more on the online. Okay. So in my twilight years, probably I will continue on to teach using the online media, okay, trying to inspire the young residents. Okay, okay. So, so let me close this by saying congratulations to the training committee of OMMC Department of Surgery, and also Dr. Guerra. Keep it up. Keep the torch burning. Okay. So congratulations again. Thank you. Mabuhay kayo lahat.
We
Thank
will,
you.
Doctor. We will keep the torch burning. And to answer your previous question, if you have trained as well, and I am very honest to say and very proud that we have trained as well. Along with Janix, with Wise, with Joman. So thank you very much.
Thank you also, Jeffrey.
Thank you very much, Dr. Joson. I guess a lot of your previous mentees overwhelmingly want to express their gratitude. And so I'd like to call on Dr. Turingan, who would also like to share a few words, sir. Ma'am, good morning po.
Good morning, Dr. Joson. Good morning, everyone. Sorry for the late attendance. My class ended at 4 a.m. So I was really sleepy this morning. I really wanted to attend this from the beginning to the end, because I know Dr. Joson will be here. As all of you, most of you know, I'm taking a Harvard class, and one of the things that struck me most while I was there is that most of the things, the teaching, the course is training to teach in medicine. And the thing that struck me most is that most of those training technique that they've been teaching us, Dr. Joson already did 20 years ago when I was still a resident. I remember as a first year, I was struggling to keep up with the program because there's no mentor to help you, to assist you, to guide you. And good. It's a good thing that when I reached second year, Dr. Hoson came in as the chairman of the department, and he really overhauled the program. He really overhauled the training, the service, the hospital service. He even got us donations to renovate the ward of the hospital, equipments, all these. I was so thankful that here I found someone I can look up to, who can teach me and who can guide me. And when I became chief resident at the end of my residency training, I I realized how much support he has given me. He supported all my decisions. He really gave me the confidence to do what I think is right. And he helped me go into a subspecialty training program in UPPGH. Although at the beginning I wanted to go to Heart Center, but he said, no, you go to UPPGH. And looking back now, of course, it's difficult there. So I was really also in that decision again. I was having a dilemma whether I'm going to stay there or not. Since at that time we ended up with just 2 residents, and then at the end of my training, it's just one. I'm only one instead of 6 fellows in the training program. So it's like I'm duty every day. But looking back now, it was a really good training program to be with. I wouldn't trade it for anything else. And now as a teacher, as a mentor for other students, I see how I wanted his legacy to continue. And I always tell this to my students, whether they're first year, second year, third year, or clerks. If you think I am good, it's because my mentor was greater. And I always tell them that Dr. Hoson taught me this, taught me that. And it's true, no? I'm a proud Hosonic. And I think I mentioned this to Sir a few months ago. We were discussing PBL, and now Harvard brought it a little differently from PBL. They went to case-based collaborative learning, but all the feedback that we do, the MAR that we do, it's actually the same. It's just a different name. And I am surprised. It's not something I'm having difficulty with. It's because it's already been taught to me at the onset when I was a resident. And so for that, I'm thankful to Sir. And I love teaching. It's because probably my teacher also loved teaching. My mentor loved teaching. And so this is something I got from him. It's not enough that you teach. It's important that that student understands what you teach. And that's something I'm very grateful for. Thank you, sir, again. Thank you for attending our webinar today. I know you're busy, and Dr. Hoson doesn't like, after retirement, he really doesn't like to accept invitations anymore. And so this is really precious. This is really generous of you, sir, for doing so. Thank you again, and live long, because I need you to be there for me for another 10, 20 years.
I hope.
Thank you, sir.
Thank you, Hazel.
Thank you very much, Dr. Taringan. So before we end our program, may I call on Dr. Opano, the current Chief Resident, to give a few words of appreciation for our speakers and our attendees.
Good morning, doctors. Good morning, everyone. In behalf of the current residents, I would like to express our deepest gratitude to all our speakers for today, to Dr. Edelweiss Petrialba, Dr. Maria Rica Lumage, and Dr. Reynaldo Hoson, and also to the consultants who shared their own experiences today. The training in the ways of becoming a surgeon, though in different times, has been relatively constant in terms of responsibilities, hardships, and outputs. Hearing them from our seniors was helpful, but hearing them today from truly successful and honorable speakers, as our topic for today states, truly inspirational. And for the journey in this field, discipline, perseverance, compassion, and love for our chosen field has been some of the important traits and the common denominator for success. We hope to duplicate these and continue the legacy as products of Ospital ng Maynila Medical Center General Surgery as Dr. Hoson campaigns with flying colors. Again, thank you po, doctors.
Thank you very much, Dr. Opano. May I call on again Dr. Guerra before we proceed with our closing remarks?
Thank you, Aubrey, for your indulgence. Mabilis lang to. I want to read you an excerpt from my favorite author. He's a surgeon trained at New York, during the 60s. So allow me to read this to you for our residents, for our students and consultants as a final note. Okay. I like being a surgeon. I enjoy the challenges of my work, the gratitude of my patients, the satisfaction I get from doing my job well. I wouldn't trade my profession for any other. I think most doctors feel as I do. Otherwise, they'll be doing something else. Because through the practice of medicine is rewarding, it isn't easy. When the phone rings at 2 in the morning and you climb out of bed, dress and drive to the hospital to deliver a baby, treat a coronary or remove an appendix, you're tested. You ask yourself, is there some easier way to make a living? And the answer is, of course, yes. But you don't switch, you don't desert, you don't give up your profession for something else. Because you can't. Once you practice as a physician, you're hooked. No other way of life is as fulfilling. But though doctors are generally speaking dedicated men, they are not saints. And no one, doctor or layman, should regard them as such. They can't live up to the image. No one could. Doctors all have the faults and frailties that membership in the human race implies. The sooner all of us realize this, the sooner we get on with the job of our improving ourselves and our profession. We're doing our job pretty well now. We can certainly do it better. That's it, Aubrey. Thank you.
Thank you very much again, Dr. Guerra. Next on, may I call on Dr. Glenn Villanueva, our Assistant Training Officer and the one whose this project was a brainchild of. Good morning, sir, Dr. Villanueva.
Thank you, Aubrey. Speaking in behalf of the OMMC Surgery Training Committee for 2022. First of all, we would like to share our sincere gratitude to our speakers today. Dr. Weiss, the pride of OMMC Surgery. Dr. Lumage, the pride of PLM Medicine. And of course, Dr. Hoson, the pride of surgery in the Philippines. It's always a pleasure having you, sir. Indeed, it was inspiring and heartfelt. As we listen to them deeply, their experiences are unique. The challenges that they encounter varies. The institutions and generations are different. And yet, if you take the context as a whole, they are almost similar. It is the desire and faith to continue and be the best of themselves that kept them going. These are surgeons of focus and determination. They see their future beyond their everyday struggles and tasks. As the saying goes, focus on your goals, not obstacles. Another important character is resilience. Resilience does not only mean that you were able to overcome an obstacle. Since life in medicine and life in general comes with many challenges and hardships. But resilience now can be defined as being prepared to be unprepared. Preparing yourself that there will be challenges ahead of you would entail resilience. Knowing that no matter how hard, it will have a purpose and impact in your life to improve and mature as you go along your journey. Sharing your knowledge and skills is also a key, since we learn as we teach. We hope that this activity opened your eyes and widened your perspective in training for the residents, in medical school, for our clerks and interns, and in the practice of medicine for all of us. Lastly, I would like to share a book entitled Attending Medicine, Mindfulness, and Humanity by Ronald Epstein. If you now were able to overcome your struggles, you were able to achieve your goals, this book will serve as a reminder of your basic role as a physician, being mindful of your patients, surroundings, and preserving your humanity. Thank you. Have a wonderful day.
Thank you very much, Dr. Villanueva. So for a message from our training officer, Dr. Maria Cecilia Leson, unfortunately, she is unable to deliver her message via video this morning, but I would like to read to the panel her closing remarks for this morning. Good morning. I would like to thank all of those who attended today's special activity. I hope you were all inspired by our speakers, consultants, especially our residents, postgraduate interns, and junior interns. I hope this will give you a view that being in the medical field, especially in surgery, is hard and challenging, but the rewards are priceless. Your time is besieged by complex challenges, yet the expectations remain the same: to serve your patients to the best of your medical ability. Hopefully, you bear in mind and keep to your heart that which drove those who now have delivered such motivational advices. To Dr. Lumage, thank you very much for agreeing to be one of our speakers. You're one of the treasured professors in PLM College of Medicine. Although we may not have met before, but still, thank you for sharing your experiences with us. To Dr. Pedrialva, thank you, Wise. I am proud of you, seeing all of you, my juniors, prospering in your chosen practice. Nag-subspec man kayo or hindi, nakakataba ng puso. And it's one of my goals in life to see you all fly with confidence, and yet your feet never leave the ground. And to Dr. Joson, thank you very much for all the lessons I've learned from you. For until these days, it helps me so much in dealing and in my decisions I make for all my patients. And right now, as the training officer of this department, following how you handled us before helped me a lot as well. Thank you again to everyone who has attended this morning's conference. Thank you to all our speakers, our consultants, most especially the residents, the junior interns, and postgraduate interns to whom this activity was made for. We all hope that you were inspired by all our speakers and all our consultants who have given their words this morning. Again, thank you very much, and thank you to all those who have attended. Yes, so I see a request for a group picture from Dr. Joson. Yes, sir, we will do that. May I request everyone to please turn on their cameras for a group photo?